Good afternoon, everybody. Today, in this e-health conference, we are trying to address some of the major issues, especially the innovations that are that have been taken up in the health sector. And I have been given this difficult task of addressing or introducing the topic to you as the theme address. Actually, we see innovations is not only doing a new thing, but innovation is also doing an existing thing in a new manner. Or you can also say an old thing and an old manner of doing a different thing. That also, if you put together, becomes an innovation. Innovation somewhere, it boils around lateral thinking, where you think out of box, where you think out of the conventional brackets, open the brackets, and then let your mind wander freely. And there we come across some solutions where we had not even thought that just by doing things differently, changes could be brought about, and major changes sometimes have been brought about in the world through the innovations. Now, especially in the healthcare delivery, innovations are very important because we are facing a lot of challenges in the healthcare delivery. And all across the world, there are challenges of access, there are challenges of availability, there are challenges of affordability. It's a major challenge in the developing countries. And what to say of the developing countries, even in the developed countries, affordability is a big issue. There are challenges of quality, there are challenges of a complete range of services, getting all the services at a single place, the challenges of accountability, both accountability of the preventive services and the curative services. And when we talk with respect to governments and the private sector both, especially the governments, these issues become very important, and we are faced with these challenges day in and out, be it public health, be it in the area of medical education, or just healthcare services in general. Now, whenever the healthcare sector is faced with these kind of challenges, these kind of issues that crop up in the day-to-day administration of healthcare, somewhere these lead to innovations. Because when we are struggling to find solutions to these challenges, and once we are able to reach properly to the actual problem, we try to find solutions, and these solutions, they become innovations. Many of them are born through very innovative application of old ideas or through the application of totally a novel idea. Why I'm emphasizing on two things, that is both the idea and the application of idea. I'll talk about it later when we talk of program implementation. That's not the idea alone that leads to innovation. It is also the effective and novel way of implementing the idea and completely implementing the idea in an exhaustive fashion. Now, these innovations, we all know they have been, nowadays when we talk of innovations, be it public-private sector participation, be it in the terms of using the information technology for innovative uses, be it in terms of emergency transport, mobile health units, in terms of quality assurance, in terms of health insurance models. So there are a whole range of innovations that have taken place both nationally and internationally. And I'm sure my fellow speakers would be talking about some of these innovations that have been done in their respective sectors. But what is more important in the entire process of policy and program implementation is how to develop these innovations. Once the idea is there, how to develop that idea and how to implement it in such a way that it is effectively implemented to yield the results. Because having an idea and implementing it are not alone sufficient. Ultimately, everything has to point towards or has to result into outcomes. So effective program implementation or policy implementation is very, very essential. And most of the time it involves a large process which involves a large number of stakeholders, a large number of partners. Nowadays, the world is of partnership. There are agencies having strengths in different areas. What we require is partnership. And through that partnership, right from problem definition, identification of causes, you develop options, you take a decision that, okay, I am going to implement this option, and then implement it, evaluate it, and this cycle goes on, because implementation again throws certain problems. Now, since I'm from Gujarat, I will like to give some idea about some of the innovations, some of the initiatives that we have taken up in the area of healthcare sector. Some of them have new ideas, some of them have same ideas, old ideas implemented in a new fashion. So the first thing I would like to focus on is the quality assurance program. In Gujarat, we have implemented a quality assurance program for all our public institutions. Now, this quality assurance program is done through the state quality assurance group, and then we have district quality assurance groups at all the districts. So these quality assurance groups, they monitor the quality of various institutions, the various public health institutions, from time to time on the basis of a set of indicators. We have developed a set of indicators. There are quality indicators for PHCs, CHCs, district hospitals as per the IPHS standards. Plus, there is a National Accreditation Board for hospitals. There is a National Accreditation Board for testing and calibration of laboratories. So all these criterion, all these guidelines are already there. The standards are already existing. Plus, we have developed a very basic guideline, which is a family-friendly hospital guideline, which is the basic initiating process for an institution to start moving towards quality, where the criteria are not very, very elaborate as we would have in, say, NABH or NABL. They are simpler and they are much easier to achieve. But this family-friendly health facility initiative, it enables us to move towards quality and to develop a sense of quality awareness, a quality consciousness in the public facility, so that they can prepare themselves for a further launch to accreditation. So we have these boards, and these boards are the district quality assurance groups that they are implementing the district quality improvement program. The objectives are, as usual, incorporation of management tools on a sustainable basis, benchmarking the indicators, and continuous quality improvement, implementation of safety and quality practices. The process is that we select the hospitals, and as far as NABH or NABL is concerned, for family-friendly hospital, we take every hospital. We had MOU with our partners, the consultants. Then we have sensitization programs. Then we do study tour to the accredited hospitals. Initially, when we did not have any NABH accredited hospital, we went outside the state. Now we have within the state the accredited hospitals. So the non-accredited facilities, they visit the accredited facilities. And gaps are identified, gap analysis is done, staff is involved, staff is trained, and then the constant process of filling up the gap, again analysis, quality management, feedback, process monitoring, and other things, finally leading to accreditation. This way, as on date, we have 14 NABH, NABL accredited government facilities. Family-friendly facilities, we have been able to develop quite a few. That's our internal accreditation process. And I'm proud to say here that because of the efforts that we have undertaken, we are perhaps one of the first state in the country to have PHCs in tribal areas that are accredited by NABH. We have Gandhinagar and Sola district hospitals are accredited. Our blood banks are accredited. Food and Drug Laboratory Baroda is accredited. Our PHCs, Maua, Saloon, Sokhda, Jetalpur, these are accredited. So in all 14 facilities we have accredited. Just these are some pictures that will show you what kind of difference in terms of facilities and performance. The quality movement, I would call it a quality movement,